Good day, ladies and gentlemen, and welcome to the SPSP Medicines WebEx Series conference call hosted by David Maxwell. My name is Sheila, and I'm your operator for today. During the presentation, your lines will remain on listen only. If you require assistance at any time, please key *0 on your telephone, and a coordinator will be happy to help you. I would like to advise all parties this conference is being recorded for replay purposes, and I'd like to hand over to David. Please go ahead.
Sheila, thank you very much, and welcome everybody to our March WebEx, and this is the final WebEx in terms of our 2017-18 WebEx series, and it's great to have you along. And as the name in terms of the title of our WebEx today gives away, we're really keen to use the opportunity to reflect on what was really been achieved through the WebEx series in 2017-18 and how we can use our time together today to inform what we do in the next year in terms of 2018-19. And before we do get started, I do want to acknowledge everybody that has been able to join today. We realize we're actually competing with a number of other national events. And we are aware of the fact that we're a small but select few, and we really do welcome you to the WebEx today, and that's fantastic. So for those that have joined via the WebEx and have not yet dialed into the audio component, we would encourage you to use the toll-free number that's displayed and the passcode. Then you'll be able to join us when we open the lines for some Q&A session towards the end. So again, welcome. And for those that are not familiar with the WebEx functionality, we have Arvind here in the room with me. He's already using the chat function. We're really encouraging everybody to use the chat box to get involved. So please do click on the chat icon on the top right of the screen, and then when you're checking as to who you want to send a message to, we encourage you to select all participants, and that way that we can all see what it is that your comments or views might be. So can I ask too, along with Arvind, that we do introduce ourselves on the chat and let us know who you are, where you're working. That would be absolutely fantastic, and we can do that as we go through. So funnily enough, today is probably the first time in quite some time that we actually have all members of the SPSP Medicines team in the room. So it's my absolute pleasure to welcome the fact we have Kirsty, Janet, and Arvind here with me. And so if you hear any noise, you can blame the team, because there's quite a few of us in the room when we go through the WebEx, but it's great to have them here. We also really want to confirm the fact that the WebEx series to date has really been committed to focus on transitions, omissions, and high-risk medicines. And again, we want to use this opportunity today to reflect on that from your perspective, and also to provide a bit of an overview in terms of the feedback we've received through our formal evaluation process. So it's great, Eleanor, hello, Lindsay, it's fantastic you've let us know that you're there, as well as Lynette, so it's fantastic to have you. And there's a few more people as well. Simon, welcome, it's fantastic, it's great to have you along. So before we jump into some of the feedback, hello Dawn, we'd really want to get an idea of just the range of folk that we've got on board. So Sheila, would you mind introducing this polling question, please?
Thank you. So the first poll, which of the following professions best describes you? Patient service user, medical, nursing, pharmacy, or if it's other, please type it in the chat box. And this poll will be staying open for approximately 25 more seconds. So if I can encourage you to select your answer and then ensure you click on the submit button. Thank you.
And while those are coming through, Karen, welcome. It's great to have you along as well from Grampian. It's great that we've got quite a broad representation across the country today, again, albeit a select bunch.
So the poll is now closed. We have all the responses, and I shall display the responses now on screen. Thank you. Just a few more seconds while the information is being displayed on the screen.
Thanks, Sheila. So I am predicting, as with other WebExes that we've held, and there it is, before I can even predict. We often have a broad range in terms of representation across the key health professions, but it's great to see too that we've got a patient service user and a few other people identifying themselves as other. And I have to confess that's me as one of those responses in being an improvement advisor here at Healthcare Improvement Scotland. So thank you all for letting us know and giving an indication as to kind of who's in the room with us today. So without further ado, we're really keen to start thinking about what it is that we've really achieved over the last 12 months in terms of this WebEx series, And I'm pleased to be able to hand over to my colleague Janet Heritage, who's going to provide an overview in terms of the probably more formal evaluation that's happened in terms of our WebEx series for the past 12 months. So Janet.
Thank you, David. As I'm sure you're aware, this is our second WebEx series, and it was built on feedback from our initial series in 2016 and 17. As a result, this year we've extended the WebEx to cover all 3 programme priorities of transition, omission and high-risk medicines. As a team, we are keen to continue to improve by asking your views on our WebEx series. To do this, we opened an online survey on the 18th January, inviting comments by email, Twitter and from our website. We used your comments on the survey to prepare a short evaluation report. If you haven't seen the report, please feel free to access it from our webpage, and we'll do our best to put the link into the chat box today so that you can see where it is. There are a few key points from the report, the main one being the average delegate numbers for this, our second series, has increased by 32% compared to the first one. But more importantly, we were delighted to welcome again participants from NHS boards, and we have increased our scope to also include representation from public partners, from Health and Social Care Trusts in Northern Ireland, universities in Scotland as well as abroad, Health and Social Care Partnership, and care home and community hospitals. The team was especially grateful to those of you who described local improvements inspired by information shared in our current WebEx series, and we will take on board all of your comments on how to improve the series for next year. Most importantly, please accept a really big thank you from the team for supporting our WebEx series. I'd like to hand you over now to David for a forward view. David is keen to get your thoughts for our next WebEx series. Thank you.
Janet, and thank you very much. And again, for those on the call, thank you so much for those who took the time to give us feedback. And I think what Janet is humbly not mentioning as well, that I think the number of people who chose to give us formal feedback this year increased exponentially compared to the opportunity that people took up the year before. And I think that gives us a lot of positive reinforcement for, first of all, the value that the WebEx series is providing for that sharing and learning, and I guess confirms for us too that there's a want for this to continue. So I think one of the conclusions that we've clearly made from the feedback we've received so far is we've made a commitment to continue the WebEx series in 2018-19, and we're really keen to have your feedback today to help inform what that will look like. So we have a number of polling questions, and I have a frog in my throat, so please excuse me. We have a number of polling questions that we're going to be putting to you to help us actually further the feedback that we've already received to date. So we're really keen to make sure that we're getting the topics right. So Sheila, would you mind opening this polling question, please?
Thank you. So for this poll, what is the most valuable improvement work you would like to see in future WebExes? Transitions, omitted medicines, high-risk medicines, combination of all those 3, or something else, please note it in the chat box. And this poll will stay open for another 25 seconds. So we're just looking for a couple of more responses, and then the poll will be closed. You can ensure you do click on the submit button once you've made your selection. Thank you. And I'm now going to close the poll. Thank you.
So while the results are coming in, it's fair to say for a program, we are committed for 18-19 to continue to focus on the areas of transitions, omitted medicines and high-risk medicines. So we would absolutely value the responses we've just got here, in the fact that the majority of folk are saying a combination of all 3. But I think it's also helpful to confirm the fact that omitted medicines is a priority being identified. And I'm assuming then that, Arvind, you've put in something else?
Yes.
Okay. Excuse me. And so that something else is around safe prescribing, is what I think I've just seen coming up in the chat box, or better prescribing. Perfect. So thank you all for that, and I think that's really helpful to confirm in terms of a sense of direction for us for the next year. We're really keen to get a sense too. We've tested a few things over the past year of different people presenting, both from within Scotland, from colleagues across the UK, and also some providers outside of the UK in terms of international speakers. So we're really keen to get your perspective in terms of who do you think is best placed to provide those presentations in terms of the improvement work in future WebExes. So Sheila, can I get you to administer the poll, please?
Yes, thank you. So the poll is now open. So again, who do you think can represent the most valuable improvement in work in future WebExes? So the choices are NHS boards in Scotland, health and social care partnerships in Scotland, UK health providers outside Scotland, international speakers, and patients, carers. So again, the poll will remain open for approximately 25 seconds if you can choose your answer and ensure you click the submit button. Thank you.
And so, again, while people are responding, we're purposely expanding, I think, purposely getting your feedback on the opportunity potentially to engage more directly with partners, patients and carers to present, which we've not done so far, and also the potential to engage with health and social care partnerships across Scotland to be potentially a bit more involved in presenting work that they're involved in. So again, keen to have people's thoughts on that.
Thank you. Just a few more seconds, waiting for just a couple more responses, and then the poll will be closed.
Thanks, Sheila.
So I think we've stopped having the responses back now, so I'm going to close the poll. Thank you.
Thank you, Sheila. And I think I want to take the time too to welcome others that have joined the WebEx and again, I really value people's input. So thank you. We can see here there's a range of folk in terms of who they feel can best present the valuable work, and that's really, really valuable feedback for us. So just briefly looking, there's confirmation around making sure we hear from our colleagues within boards, and a move to ensure that we include health and social care partners, and as well as patients and carers. So that's really, really helpful again. We will be providing these responses back as part of the recording. So for those people who are listening on the call, we'll be able to share these with you after. So in addition to who presents, we have been providing feedback and sharing the resource after the WebEx in a number of different ways. So we'd be really keen to get your thoughts on how we best, in terms of sharing our learning or the shared learning, how we best promote those with others. So this polling question is a little bit different in the fact that you can actually present, select one or more of the options. So Sheila, would you mind administering this poll, please?
Thank you. So again, which of the following activities should we continue to do to share the key points of the WebExes? And if you could please select one or more of the options. So you've got a choice of key learning summary document on the website, PDF of slide sets on the website, recording of WebEx published on HIS YouTube channel, tweet with links to the SPSP Medicines website, or something else, please record it in the chat box. And again, you can select more than one of those options. Thank you. The poll will remain open for a few more seconds. We've had a majority of answers back. So I'm going to close the poll now. Thank you.
Thank you, Sheila. Okay, that's fantastic. So I guess we've got, again, this is all very quick and dirty in terms of review of the responses, but it has given us confirmation of the key learning summary is what the majority of people think we should continue to do, as well as the recording of the WebExes, which is absolutely fantastic. And the idea of the PDF of the slide set is something we would endeavour to continue. So Simon, I noticed that you've said that you don't really visit the website, so a circular would help. And I guess that's something we've not done formally in terms of using email as a way of circulating links back following the WebEx, and it's something we could definitely consider. We have used Twitter quite a lot, and I'm not surprised of the responses that a lot of people aren't using Twitter as the main port of call to find out a lot of the work that we do. So we'd be happy to explore different methods in getting the word out following our learning for the WebExes. We're also considering how we best engage people in the lead up to the WebEx series. And this particular WebEx today, we did forward an attached evaluation report in advance of the WebEx. And we're really keen to explore as a principle where available if you think any pre-reading would actually help in advance of the WebExes. So Sheila, can I ask if you wouldn't mind administering this poll as well, please?
Thank you. So the poll is open, and again, where available, would you find the sharing of pre-reading in advance of future WebExes helpful? Either yes or no. If I can ask you to select your answer, ensure you're clicking on the submit button once done, and the poll will remain open for the next another 10 seconds. Thank you. Okay, just a few more seconds and the poll will be closed. I could urge you to submit your answers to the question. Okay, the poll is now being closed. Thank you.
Thank you, Sheila. And I do have to confess, one of the options that we did not put for that one question is, I'm not sure. So I'm assuming that either people didn't answer because they weren't sure, but I know Arvind, we're not answering here because of the fact we're asking people outside. But the resounding kind of feedback where available, I think it would be helpful. And I think that's actually useful to know for us and also helpful for those on the call that for the April WebEx, which we will talk about later on, there will be pre-reading. So it's really good to know the fact that we'll be sending out some things in advance to help with the April WebEx, and that's really good. Sheila, can I ask if you wouldn't mind opening all of the microphones? We've got a couple of questions that we'd like to put that aren't polling, but generally free text, and I think it'd be valuable if we could have some conversation around these as well, please.
Thank you, and all lines are now open.
Thank you, Sheila. So with all the lines open, there is a risk that we might get some background noise from those on the call, but we ask if you could try and keep that to a minimum. We thank you for your input so far. I guess what we've learnt to summarise is that we do want to continue with the 3 key areas that we have been focusing on, but there's also been some requests around some prescribing skills assessment and improvement in a focus more on prescribing, which I think again is linked in to quite a large part of our key priority areas of transitions and high-risk medicines particularly. So we're really keen to now seek your feedback around your contribution to the WebEx series. So considering the priorities and those other priorities that have been identified today on the WebEx, I'd really like to put to you to challenge today to commit into the chat box what local improvement activities you'd be willing to share during the 18-19 WebEx series. So please use the chat box to do this. I think it's really been useful to confirm from your perspective that you do want to hear from people in Scotland about the work that they do. So I put the challenge to you, what work that you're doing in Scotland would you be willing to share? So I'm going to pause and ask everyone to just type in the chat box what types of things you'd be willing to share over the next 12 months. I'm assuming that people can type, and I will give you some more time. I'm not being smart. But we're really keen just to get an idea of what kind of things that are happening in your place that would be of value to then share with others. And Arvind, I know there's some testing happening in Lothian already in terms of a framework around prescribing supervision and learning from prescribing. So I think that's something that we could really be keen to share as part of the series.
Yeah, thank you, David. Yes, I think it's we've got a project that has already had at least one test, and we've got a good team, so we should have some data on whether it works to have a structured feedback to foundation trainees who are involved in prescribing errors and the impact of that on reducing errors. We'll definitely share it, whether or not it's successful.
Well, thank you very much. And Simon, thank you again. I know you've been part of the WebEx series as a participant for a while, and I think it's great. There's a potential opportunity here to learn a little bit more about the prescribing assessments that you've been talking about. So that would be absolutely fantastic, and that's great. And Sue, thank you. Feedback from community, especially with regard to social prescribing. Sue, can I get a little bit more feedback around what that means to you? Because I'm very curious about that.
Yes, well, as an example, this morning I participate in oxygen therapy, and before it started there was 6 people, various conditions, strokes, diabetes and things, and before we had to put our oxygen masks on, we were really communicating with each other, telling jokes, and it just made everybody feel so much better.
Excellent, excellent. So,
but and through this, you know, through the meeting of, you know, with the therapy this morning, there is a new initiative with Breathe Easy. They've started a singing group in Perth.
wow.
Now the problem is that people don't know what they don't know. So how can we get this through to the GPs so that they can refer people to the social prescribing?
That's
make sense?
That's fantastic. I'd be really keen to explore this with you in terms of after the WebEx too. And so just to check in too, it's prescribing social activities to improve health alongside probably more traditional prescribing of medicines.
That's right.
Perfect. Thank you, Sue. That's really helpful.
Fantastic response.
Really, really good. Thank you. And Simon, it's great to hear from you too. I can see, again, I'm quite impressed with Lothian's commitment. So far, that's the 3rd idea I think we've come through from Lothian today in terms of sharing the evolution and progress of a multidisciplinary hospital-based working group. Would absolutely love to hear about that. I know a number of boards are always interested to learn about how medicine safety work is being progressed in other boards and what kind of teams and how things work to get a cross-organizational approach. So that would be fantastic. So, Simon, can I check, is there anything in particular at the minute, do you think, that stands out with the work that you're involved in?
Sorry, anything particular at the minute that stands
out in terms of the evolution?
The particular thing I've noticed is it's really quite nice to get lots of different people together around the table from different disciplines who are all facing the same problems but are achieving, you know, improvements in different ways. And I kind of feel it's quite nice to learn from the successes and not repeat the failures.
That'd be great. Okay, thanks, Simon. And again, thanks for being part of the WebEx today. And Karen, it's fantastic to have ANP kind of reflections here as well, in terms of the acknowledgement you've got here of the prescribing framework, as well as some improving meds rec and inpatient prescribing. We would never say no to anyone that's doing work in that area as well. But Karen, is there anything particular that you would want to add to that just now? No.
Karen may not be on the...
That's okay. Karen, thank you for that. And again, one of the things that we will be doing, there are a few specific requests in terms of topics to be covered that have come out through the evaluation series. Thanks, Karen. So we'll combine both the offers today and also the asks that we've received in terms of that specific question of what would you like covered in the next year, and to then come up with content for 2018-19. We do note the offers today, and we will not be shy in making contact to follow those up, and looking to see how we will then fill the calendar and start that promotion. One of the things we're keen to learn a little bit more about too, from your perspective, is how we can improve the way the WebEx series are promoted. One of the things that we do use quite a lot of is Twitter, but again, the feedback we've received to date is that's probably the least common way that people are finding out about the WebEx series. So can I open to general discussion of how do you think we can better improve the way we promote the WebEx series? So Simon, can I check with you? Do you think email is the best way from your perspective? I know you mentioned you're not on the website very often. Is that something that's the most effective?
Yeah, I think if you're you wanted to get hold of people, then a little bit of news and maybe highlighting what's coming up on the next WebEx might work. I have to say my life's pretty busy now, so I don't tend to trawl around websites seeing, you know, what the latest update is. I think if it doesn't arrive in my inbox, I'm not going to see it. I'm on Twitter, but I have to say I'm not following you, so that's not the way that I get my messages. Maybe I should follow you. It might be an exciting addition to my Twitter feed. The other thing is, if it's medicines and you're the medicines part of Scottish Patient Safety Programme, I mean, shouldn't you be sort of you know, sending things out via the ADTC network?
Yeah. So you're absolutely right, and that is something that we do. So again, using email, all of the information in terms of the upcoming WebEx series and confirmation of things being available are communicated via email through the AGTC Collaborative here at Healthcare Improvement Scotland. So that is a link that we have made, and maybe there's an opportunity to strengthen that, but that is, you're absolutely right. So I'm just thinking of those folk as well. So Dawn, I know that you're on the call, so apologies for picking on you. And thanks, Simon, to admitting that you don't understand Twitter. But I'm just wondering how...
Oh, no, I understand it well. I'm on Twitter and use it a lot. And sadly, I'm just not following you. But as I acknowledge, it might brighten my Twitter life up a bit to follow you.
Simon Maxwell, it was Simon Dummer who made that comment. Apologies. Simon Dummer has just put into the chat box that he does not understand Twitter. So apologies for the mix-up there. So I'm just wondering, in terms of the email and how accessible the information we provide to then forward on to colleagues, because I understand that we do often have a number of people on the WebEx series that aren't in our key contact lists, and they've obviously received it from somebody. So I guess that's just seeking some kind of feedback from those on the call about the utility of the information that you do get, whether you're the primary key contact or otherwise. So Dawn, I know that you're on our key contact list, and I'm just wondering how usable the information that we provide you is to then send on to colleagues.
Hi, David. Yeah, it's useful. The problem here is size, in that it's very difficult we wear so many hats in a small board to actually come away from other things. Like, I will admit I haven't been to many of the WebExes this year, but the fact that they tend to clash with other things, meetings in my diary. So I don't know whether it's possible to potentially get more engagement if you move the times around a bit. I don't know whether that's possible, and probably other people will think, no, that's a load of rubbish. But they tend to clash with other meetings that I need to attend, so that's why I've not been involved much this year.
And that's absolutely fine. And I think one of the things we need to acknowledge, we're absolutely aware this WebEx series has to fit in with clinical commitments and busyness. So that's why we have recorded every single one of the WebEx series that we've run this year to allow people to come back and look at them and view them in their own time. Because I absolutely understand. I think if we moved it to another time, we'd probably get similar feedback from others as well, that this is not a suitable time. But we also had feedback, the fact that if it's regular every month and we don't move it, they at least know that on the third Thursday of the month, this WebEx is on. And if they can't make it this month, they can try next month. So we kind of have to balance that level of, I guess, flexibility.
What we could do is potentially, when we send it out, ask people if they can't attend to say whether there's a particular time in the week that they might regularly be free, and then if there are lots of people free at a time and we can arrange it, we can. I think with apologies if people said when might work for them, who knows.
That is something we consider. I do think there has to be a balance between predictability and flexibility, and we'll work through that. But I guess, and Lynette, thank you. You've got emails best. Might be worth sharing distribution list so that amendments and additions can be made. And that is a fair call. One of the things that we actually could do would be to even list by board and share with our key contact. These are the people that we have in our key contact lists for your board. Is there anyone that needs to be added? And that's something that we could then extend the reach with a single communication. So Lynette, thank you for that. And we could do that relatively easily. in terms of just filtering our contact list by board. Are there any other suggestions or comments in terms of promotion of how we best spread the word of the WebEx series? Okay, that's fine. We can take silence as that we've got quite a few ideas anyway in terms of how we do that. And I think what's been really valuable as well is the confirmation that email is probably our main traffic way of getting the message out to folk. So that just reinforces the importance of us to have that contact list as up to date as we can, and also give opportunities for people to add folk that they think should be included in that communication, which we can do. I think that's really helpful.
David, just on that point, can people ask that they be put on the contact list themselves? Does it have to be?
No, absolutely. It's not something that we control or manage in any way, but it's usually, I think the contact list has evolved quite organically through people that we've met going out to boards, and we've asked, we've got a contact list, would you like to be added? And that's usually been some of the ways. We've also automatically put people onto the list, like SPSP program managers, anyone that chairs a local medicine safety group. These people are already part of that group. So, yeah, we can add anyone. It's not an exclusive or limited list. So I guess that, yeah, the only thing that I think we really need to think about from now, because I think we've actually asked all the questions that we had from you, is that to put it to anyone if there's any other comments or points they'd like to make before we consider and start promoting what we're doing next month. So are there any other comments or things that people want to tell us about the WebEx series before we move to the April content? Again, I take silence from the call that we're kind of saturated there, which is great. So, Arvind, is there any final comments from you before we move on?
David, I like the idea of the email, but an email with lots of files sometimes gets difficult and we get large file volumes. So one of the questions I have is whether it's easier to email people with a single same email every time, but actually with a link to a page that we can update. And that page can be the page with the something about the next WebEx, and potentially it could be a discussion board where people can then look at it and respond to us about things they're interested in. So we then control the content so it's available. I recognized what Simon Maxwell said about not going to the web page frequently, but again, for Simon, as much as for anybody else, it would be helpful not to have files sent by email, but a link that he can then click on to.
Yeah.
Is that something that would work for all of you?
Thanks, Simon Dummer. The answer is yes. So I guess that even that model, we're still using email as the main port to actually acknowledge that the WebEx is going to happen, and so that email is the prompt that people will look at because it's in their inbox. But we can then potentially link off from the email for further information. So fantastic, we've got some consensus there as well. So in saying that, we can test that for our April WebEx, because as we mentioned before, there is going to be some information available that we would like people to read prior to the WebEx. So for those who were not directly involved, we hold a stakeholder engagement, a stakeholder exchange back on the 8th of February, and we're really wanting to use the 19th of April, which will be the first WebEx of the 18-19 series, to teach back, but also check back that the feedback and analysis that Arvind and I and the rest of the team have undertaken since then is actually in line with what actually happened on the day. So we'll be testing everybody's memories, but we will be forwarding in advance of the WebEx a summary of the outcomes and also suggested next steps. And we'll be really looking to use the WebEx on the 19th of April to confirm both the outcomes and looking for feedback in terms of how we can then move forward. So we will test the idea of creating a website to put the page and all the resources on there, and we will use the email to then direct people to that. So that is really where we wanted to end up today. And we really appreciate the fact we've got some invaluable feedback in confirming how we move and looking at a forward view. We'd encourage you to tell folk about the 19th of April. And for those who do want to follow us on Twitter, our Twitter handle is SPSP Medicines. And we'll also have got a number of actions now that we can take away from today to help with the promotion and the spread, which has been, again, invaluable to get your feedback on how we do that. So on behalf of the team here in the Guile, thank you all very much for your time. And we look forward to joining us on the 19th of April for the first of the 1819 WebEx series. Thank you very much.